Greetings, I'm Dr. Neha Gupta, and today we are going to discuss regarding the fever which has gripped the entire northern India. As we all know that from the last few months, Firozabad district is battling dengue fever, and similarly there are cases of fever which is resulting in deaths of children in certain parts of northern India. So when we talk about fever during the monsoons, there are few common causes which come to our mind, and they are: first is, could it be malaria, typhoid, dengue, leptospirosis, rickettsiosis, or viral fever, or it could be fever because of some other causes. Say it can be amoebic liver abscess and tuberculosis, and say so many causes of infection. So out of these, when we are talking about acute undifferentiated febrile illness, then there is, what we need to look at is the pattern of fever, that how the fever has started, what has been the progression of the fever, and of course the associated symptoms with it. And then we perform certain tests. For dengue fever, we do a CBC, which actually helps us in determining the leukopenia and low platelet count, or the thrombocytopenia, which usually happens around day 4 to day 5. And if suppose there is a increase in the WBC count, that will go against dengue fever. It will favor some other conditions like leptospirosis or rickettsiosis. So CBC is very important. Subsequently, we need to do serology for dengue, which is the rapid test as well as the ELISA, which is available, and based on the rapid test has a faster turnaround time, ELISA takes a longer time. But with rapid test, even if we do NS1, IgM and IgG, the sensitivity is only 80%. So a patient with fever, and if we are doing only the NS1 or only the IgM, we may pick up only 65 to 70% of the cases, and we can miss out the rest of the cases. So it's important to do all the three serologies, plus IgG usually appears on day 9 and last for a longer duration in primary dengue. But in secondary dengue, IgG can appear much earlier, and it's secondary dengue which is associated with more complications. So it's the test which we perform in a patient who's presenting with fever is also very, very important for the right diagnosis and initiation of the right treatment. Thank you so much.